Can IVDD be prevented? What every dog owner needs to know. If I told you there was one thing you could do to guarantee your dog would never develop IVDD, I would be lying. I wish there were a magic supplement, a perfect exercise, a special harness, or one simple rule that could completely prevent this disease, but there is not. What there is, however, is a growing body of evidence suggesting that may reduce your dog's risks. There are also many common myths that may not help nearly as much as people think. So in this video, I'm going to separate fact from fiction. By the end, you will know what I recommend to my own clients, what every owner of a high-risk breed should understand, and where preventative options like PLDA may fit into the picture. Let's get started. Hello, I'm Dr. Gaemia Tracy, a board-certified veterinary neurologist. Every week, I meet families whose lives change in an instant. Sometimes they tell me, he was completely normal yesterday, or she jumped off the couch just like she had 1,000 times before. Then they pause and ask me one of the hardest questions I hear. Is there anything we could have done to prevent this? I wish that question had a simple answer. Sometimes the answer is no. Sometimes there may be things we can do to reduce risk. But the truth is that IVDD is a complicated disease. Genetics matter, body condition matters, lifestyle may matter. And although nothing can completely eliminate the risk, there are practical steps that may help stack the odds in your dog's favor. My goal is not to scare you or promise something medicine cannot deliver. My goal is to help you make an informed decision based on what we currently know. First, what causes IVDD? To understand prevention, you first have to understand the disease. The discs between the bones of the spine act like cushions or shock absorbers. In dogs with IVDD, those discs begin to degenerate. Over time, the center of the disc can harden and become less flexible. Eventually, part of the disc may herniate into the spinal canal and place pressure on the spinal cord. A few months ago, I treated a Dachshund whose owners were devastated. They told me he was running around the yard yesterday. This morning, he could not use his back legs. They wanted to know what had happened. Did he jump off the couch? Did he play too hard? Did they miss something? Did they do something wrong? The answer was probably not. IVDD usually does not begin with the final jump. The disc disease may have been developing for months or even years before that moment. Sometimes a disc herniates after a jump. Sometimes it happens while a dog is playing. Sometimes the dog simply gets up after sleeping. And sometimes there is no obvious event at all. That is why we have to be careful about blaming one particular movement. The jump may have been the final straw, but it probably did not create the disease. It revealed a problem that had already been developing. Myth number one. If I never let my dog jump, they will not get IVDD. This is probably one of the most common beliefs I hear. Can repeated high-impact jumping place stress on the body? Yes. Could reducing repeated jumping be reasonable, particularly for dogs that are older, painful, recovering from an injury, or already affected by spinal disease? Absolutely. But does preventing every jump guarantee that your dog will never develop IVDD? Unfortunately not. I have treated dogs whose owners used ramps, blocked the stairs, and did everything they could to prevent jumping. Some of those dogs still developed IVDD. I've also met dogs that jumped on and off furniture for years and never developed a clinical significant disc herniation. That does not mean jumping is harmless. It means jumping is only one part of a much larger picture. Using ramps can still be practical. They may reduce repeated impact and make it easier for your dog to access furniture or the vehicle. But a ramp is not a guarantee against IVDD. Body condition matters. One of the most important things you can influence is your dog's body condition. Extra weight places more mechanical stress on the spine and the joints. It may also make it harder for a dog to move comfortably and recover if a spinal injury occurs. One thing I can tell you from experience is that dogs who stay lean generally move better. They often tolerate activity better. And if they become injured, mobility and rehabilitation may be easier. So when owners ask me, what is one thing I can do right now? Keeping the dog at a healthy body condition is often near the top of my list. You should be able to feel your dog's ribs without pressing hard. Your dog should have a visible waist when viewed from above. If you are unsure whether your dog is overweight, just ask your veterinarian to assess body condition rather than relying only on the number on the scale, because the ideal weight for one dachshund may not be the ideal weight for another. So body condition matters more than chasing a specific number. Exercise is important. Another common misconception is that dogs at risk for IVDD should avoid exercise. That is not generally what I recommend. Regular, controlled activity helps maintain muscle mass, balance, coordination, and cardiovascular health. Walking is usually beneficial for most healthy dogs. Strong muscles help support the body and may improve overall mobility. The goal is not complete restriction. The goal is appropriate activity. There is a difference between controlled exercise and uncontrolled, repetitive, high-impact activity. A steady walk is not the same as repeatedly launching off the furniture, twisting in the air, or sprinting up and down stairs. Your dog does not need to live wrapped in bubble wrap, but thoughtful activity is better than either extreme. Too much high-impact activity may be unhelpful. Too little movement may contribute to weight gain, muscle loss, and poor condition. What about ramps and stairs? Ramps can be useful, especially for dogs who have difficulty jumping or climbing. A good ramp should be stable, wide enough for the dog, and covered with a surface that provides traction. A steep, slippery ramp may be harder to use than a low step. If you use a ramp, take time to train your dog to use it confidently. Do not simply place it beside the couch and expect the dog to understand it immediately. Use treats and positive reinforcement. The same applies to stairs. Not every dog needs to be carried up and down every staircase for life. But if your dog is painful, weak, recovering from IVDD, or has poor coordination, stair access should usually be limited until your veterinarian advises otherwise. What about harnesses? Many owners ask whether using a harness instead of a collar can prevent IVDD. A harness may be more comfortable for some dogs, especially dogs with neck pain, respiratory problems, or a tendency to pull. It may also give the owner better control. But we do not have strong evidence that using a harness alone prevents disc degeneration or disc herniations. A harness can be a useful tool. It is not a cure for genetic disc disease. That distinction is important. What about supplements? Owners frequently ask about glucosamine, fish oil, collagen, turmeric, chondroitin, and supplements marketed specifically for spinal health. Some supplements may have benefits for joints, inflammation, or general health, but at this time, we do not have strong evidence that any supplement can reliably prevent IVDD. That does not necessarily mean every supplement is useless. It means we should be honest about what the science can and cannot tell us. Before giving any supplement, talk with your veterinarian. Supplements can interact with medications, affect bleeding, they can upset the stomach, and they vary widely in quality. Do not assume that something is automatically safe just because it was sold over the counter or labeled as natural. Genetics matter. This is often the hardest part of the conversation. Some dogs are genetically predisposed to IVDD. Breeds such as Dachshunds, French Bulldogs, Corgis, Beagles, Shih Tzus, Pekingese, Basset Hounds, they're at higher risk. You cannot change your dog's genetics, and genetics are not fair. I have treated dogs whose owners did everything right. They kept the dog lean. They used ramps. They provided regular exercise. They stayed current with veterinary care, and the dog still developed IVDD. I have also seen dogs that seem to do everything wrong and never had a major disc herniation. That is why I never want owners blaming themselves. Your goal is not perfection. Your goal is to stack the odds in your dog's favor. You may not be able to eliminate risk, but you can improve body condition. You can encourage safe activity. You can learn the warning signs, and you can act quickly when something changes. Early recognition is part of prevention. Prevention does not only mean stopping a disease from ever happening. Sometimes prevention means preventing a mild problem from becoming more severe. Learn what is normal for your dog. Know how your dog usually walks. Know whether your dog normally jumps on the couch without hesitation. Pay attention to trembling, yelping, stiffness, wobbliness, toe dragging, or weakness. Dogs often whisper before they scream. The sooner you recognize those whispers, the sooner your dog can be evaluated. Early recognition may not prevent the disc from degenerating, but it may help prevent continued activity from making an injury worse. It may also allow your veterinarian to discuss treatment options before severe neurological deficits develop. Where does PLDA fit? Now let's talk about a preventative option called PLDA. PLDA stands for percutaneous laser disc ablation. It is a minimally invasive procedure designed to reduce the risk of future disc herniation in selected discs. During the procedure, needles are placed into certain discs using imaging guidance. A laser fiber is then used to treat the center of those discs. The goal is to reduce the likelihood that those discs will later herniate into the spinal canal. PLDA is not appropriate for every dog. It does not guarantee that a dog will never develop another spinal problem. It also does not treat every disc in the entire spine. Candidate selection matters, timing matters, and the procedure should be discussed with a veterinarian who understands IVDD and can determine whether the dog is an appropriate candidate. Published research has reported a meaningful reduction in future disc herniation among appropriately selected dogs after PLDA. But it is important to explain this accurately. PLDA reduces risk. It does not eliminate risk. That is a very different promise, and it is the honest one. So what do I recommend? If I owned a Dachshund, French Bulldog, Corgi, or another high-risk breed, here is what I would do. I would keep the dog lean. I would provide regular controlled exercise. I would use ramps where they are practical and where the dog can use them safely. I would avoid encouraging repetitive, uncontrolled, high-impact jumping. I would learn the early warning signs of IVDD. I would seek veterinary care promptly if my dog became painful, weak, wobbly, or reluctant to move. And if my dog were an appropriate candidate, I would have a detailed discussion with a veterinarian or veterinary neurologist about whether PLDA should be considered. None of those steps can guarantee prevention, but together they may help reduce risk, improve preparedness, and give the dog the best opportunity for a healthy, active life. Final thoughts. I want to leave you with one final story. After surgery, owners often ask me, will this happen again? And my answer is always honest. I cannot promise that it will not. No one can. But what I can tell them is that knowledge changes what happens next. Owners who recognize warning signs earlier may seek care sooner. Owners who keep their dogs lean and active may place them in a better position for mobility and recovery. Owners who understand their dog's risk may make more informed decisions before an emergency occurs. That is why I make these videos. Not to create fear, but to replace fear with knowledge, because dogs often whisper before they scream. And when we learn to recognize those whispers, we have a better chance to act before the problem becomes more severe. If this video changed the way you think about IVDD, do not keep it to yourself. Think of one person you know who owns a Dachshund, or a French Bulldog, or a Corgi, and send them this video today. One conversation, one text message, one shared video. These could all help another owner recognize risk sooner and make a more informed decision for their dog. Subscribe to the SpineShield channel for clear, practical, evidence-based information about IVDD, spinal health, treatment, and prevention. Every week, I'll help you separate myths from medicine so you can make the best decisions for your dog. I am Dr. Gaemia Tracy. Thank you for watching. And remember, because one jump should not end a lifetime.